All right, we are back with Dr. Johnson of Grandover Village Dental Care. He's answering all of your dental hygiene questions. Okay, so we just got a text. How long can you go with a filling that partially fell out?
Ooh. Well, how long is kind of up to, nature. And how much you can tolerate the pain or the sensitivity. I would encourage you to go as soon as you can, ASAP, because things start off with a little chip, a little piece of the filling out, then it progresses to all of the filling out, or the chip has now progressed into a whole crack through the tooth. So if you've noticed something and you feel a little twinge, just call us. I try to see patients, if you call in with an emergency, at least a day or two, within a day or two, so we can get that a handle for you.
Kind of the sooner the better situation in that.
Absolutely.
Okay, so then what do you think of the trend of brushing your teeth with coconut oil?
Mm, so for whatever reason, we all try to find something that's not toothpaste to brush with. As your dentist, I'm going to recommend toothpaste. I'm going to recommend the fluoride because scientifically has ingredients in it that not only stop cavities, but also help to strengthen enamel. So there's nothing better than toothpaste as far as brushing. If for whatever reason you really don't want to use toothpaste, I haven't heard of coconut oil being something sustainable, nor charcoal. Charcoal is actually pretty abrasive to teeth. Baking soda is kind of a more vanilla ingredient that you can use if you really just don't want to use toothpaste. But all in all, there's not going to be anything better than toothpaste, especially if you want things like whitening or extra protection to your gums. Toothpaste.
Great advice. Okay, this next viewer says, I want an implant. They say I need a sinus lift procedure. How invasive is this surgery?
It depends on how far up your sinus needs to be lifted, how far down it is, things like that. But from a patient standpoint, I would say it's not as invasive as it may sound. There are, some incisions that need to be made, some things that need to be done afterwards to ensure that you heal correctly. You don't have have too much pain. But in terms of I guess like things people can go through, hips, knees, things like that, those are going to be way more intensive and have way more rehab than something like a sinus lift. But if if whoever is kind of encouraging you to have these procedures also doesn't offer you alternative options, that's something you want to consider too. You want to have a couple options so that if you are worried about a procedure being invasive, if you are worried about kind of the healing, things like that, you can at least have another option.
I think that's great advice too. Okay, so then the next question is, how do I know when to get dentures?
When you don't have any teeth.
I mean, yeah, pretty point blank, right? Can
Yeah.
you get dentures, I guess, too, when you have a few teeth left?
Yes. So we do those are called partial dentures. Um, And if you're missing teeth and you have issues with teeth kind of crowding spaces or teeth shifting, a partial would be good to kind of stabilize where things are at. One partial will also be good to help you chew. If you're missing some of those more important teeth in the back for chewing, you definitely want to look into getting a partial. I see some patients where pretty much all their back teeth are gone, they're just left with the front. That's not ideal. You don't want to be chewing with your front teeth. They're different shapes. They're not made for chewing. They're made for kind of, ripping and things like that. So if you're experiencing things where you have to chew with front teeth because of lack of back teeth, come see us. Let's talk about getting some type of partial, give you some type of replacement for those back teeth, because that's a scenario that long term is not going to be good. If you're missing front teeth and, cosmetic or appearance wise, want replacements, partials are ideal for that. Or even if, like the last lady, you're getting an implant and in the interim, you need something to place up there, you can also do a partial for that. So I think we get really good results with some of those things. So if that's something people are interested in, definitely come and ask about it.
So the next question I have for you too, do you accept Medicaid at your practice?
In my practice, we do not. But if you come in or even call, we do have an office that we refer to. Uh, we refer Medicaid patients to. Just off the top of my head, Dr. Stokes in town. She may be very busy, but I know she accepts some. And if there's somewhere else that someone may want to go, just come see us. We have the resources to find you a dental home.